Okay, so I have the honor of speaking with Amy Rodgers from the Music Settlement today. She's a music therapist and she's going to invite us into a discussion about art and music therapy and how it's good for our health and our overall well being. So, Amy, thanks so much for allowing me. Why don't you introduce yourself, tell everyone who you are, what you do, and your role with the Music Settlement?
Sure. Thank you so much for having me. I'm honored to be here. I am the chair for the Center of Music Therapy at the Music Settlement. I have been newly hired in the last 6 months, so I'm learning my new role and everything about the Music Settlement as well as the Cleveland area, which has been fun and exciting. I was brought in to kind of revitalize the program and create some new programs within the Center for Music Therapy. My background is being a clinical professional, practicing mostly with children who are diagnosed with autism for about 15 years. And about 8 years ago, I started working with West Virginia University to develop their undergraduate degree program and then all of their university hospitals programs. And so when the position became open at the settlement, it seemed like a natural fit for me and kind of a combination of all the things I've done and my professional experience coming together in one place. So I'm really excited to be here.
Oh, that sounds like a symphony.
Yeah, yes, exactly.
Right, nicely orchestrated.
That's right.
We're talking about music, so why not use musical verbs?
I love it.
Okay, so Amy, what constitutes art?
So I like the saying, beauty is in the eye of the beholder. So similar to that, I think art is really defined mostly by the person, just interpreting whatever is being presented to them, whatever they're seeing or hearing or taking in. Now, that being said, when we look at specific art forms like music therapy, for instance, my specialization, there are some things that we know to be factual and very true about human beings respond to particular elements of music and how that can influence their perception of behavior. So I feel like giving room for both intentional structure as well as flexibility in the definition of art is helpful.
Mm-hmm. I agree with that. I agree very much with that. So, in the discussion about the influence of art and music on health, it's only fair to also ask the same question. What is the definition of health? For instance, if someone is not ill, does that mean that they're healthy automatically?
I love that question. And I went right to my favorite definition from the World Health Organization. This is a quote, that health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. And I love that because I think that in the last 15 years of my practice, there's an increasing emphasis placed on music therapy for wellness. So that allows us to take a look at people who do not have a medical diagnosis, which usually names an illness as we're talking about it. And so we can practice music therapy and other creative arts therapies within that context of the World Health Organizations of overall health.
Mm, that's very interesting. I like how you said something that's not named medically, some specific way you put it, because everyone feels that if they haven't been diagnosed, I don't want to say everyone, but it's been the general consensus now that if you're not diagnosed or if you're not seen or something, how can you say that you are ill or how can you say you're not ill if a professional per se has not given you the diagnosis? But there's a flexibility here in the sense that, there's all types of other crevices and things that we may not pay as much attention to that are not on a prescription pad. So it's very important that I think we're having this discussion to make some awareness of the other aspects of our lives that we can personally enhance and enrich through the creative arts.
Absolutely. I mean, as human beings, I think that we all have needs, whether they are officially recognized or not.
Mm-hmm.
Part of the human condition, I think.
Absolutely. Yes, wonderfully said. Officially recognized or not. Yes, I like that. So, what is the connection between creative arts and health outcomes? A discussion that needs to be amplified. Why would you say so?
Yeah, I think that luckily we are starting to see this amplified more and more on many levels. So one of the most profound ways that I think I've seen this happen in the past few years is when the National Institutes of Health and the JFK Center for the Performing Arts, they partnered together, and they have created this beautiful collaboration called the Sound Health Initiative. And this is really recognizing the exact connection that you're talking about, and how can we intentionally foster and develop that connection for the good of all people who are accessing healthcare.
I think that's very important. I think when organizations begin to do these innovative, non-usual ways, I think it makes a well-rounded situation and a well-rounded person, and they realize that these are things that are easily able to be incorporated into their lifestyle.
Absolutely. And I like it at the leadership level too, to highlight that, because I think a lot of this happens on the grassroots level. We see a lot of music therapists co-treating with other therapists, physical therapists, occupational therapists, counselors, and that sort of thing. So having it at all levels, I think, is awesome.
I see why they wanted you to come to the music settlement. Wow.
Thank you.
So, chronic stress and depression are known to contribute to health and emotional problems. What are ways that people can receive the benefits of creative art and music therapy in everyday life, would you say?
Yeah, so I think this is where it becomes important to highlight that there's an entire continuum of creative arts engagement. So we all have everyday activities that we access that we may not even think about. So listening to the radio on your commute when you're in your car is a very everyday thing that is very accessible and just kind of blends into the background of our lives. And then throughout the continuum, there are different levels until we get to the engagement of a creative arts therapist. So a therapy would then be provided by an educated, board certified, and licensed professional, and it's a very intensive form of applying music or art or dance for an individual's needs. And at any point in a person's life, all forms and levels of engagement can be beneficial depending on what their needs are at that moment in time.
Very good, very good. So that makes me wonder, on the clinical side, how does music therapy affect the brain and sensory perception?
Sure. First, let's start with what is music therapy, which is a question that I get a lot. And there may be some readers or listeners who don't understand what we mean by that term. So music therapy is a rehabilitation service, and we use music as our tool for the treatment of non-music goals. So that can be cognitive functioning, communication, socialization, emotional regulation, and so on and so forth. So the music therapy service is provided within the context of an ongoing, consistent therapeutic relationship by this board certified or licensed professional. Here at the Music Settlement Center for Music Therapy, so we're the first community music school in the United States to provide individual and group music therapy services, which I think is really cool for me as a music therapist, to have that history in the place where I'm currently working. And so at the settlement, we currently see clients of all ages at our University Circle and Ohio City clinics to address a variety of health needs. So we may have clients who have mental health, trauma, or addictions needs, the symptoms associated with those things. They may be diagnosed with developmental delays, autism, or Down syndrome. And then again, any age, we have older adults with dementia, Alzheimer's, or traumatic brain injury diagnoses. We also serve similar population groups at our partnership locations throughout the greater Cleveland area. And all of this is with the overarching goal of improving the quality of life and either maintaining or improving their daily functioning skills of these individuals receiving treatment. And so while music therapy treatment has a lot of evidence-based positive outcomes for their patients, to your question about the brain and sensory perception, music is so unique because it both activates and calms the brain simultaneously. And so it uses many different parts of the brain at the same time in order to process the music that we're experiencing. So this makes it an ideal tool for treatment because music can influence our neural pathways, which influences our bodily functions, which then influences our decisions and behavior.
Mm-hmm. That's very powerful because we all want to have a calm brain.
Yes.
We all do.
Yes.
I mean, we need that to make rational decisions and not be frazzled and do things that we later wonder why they did them, but at the time it seemed like a good idea, you know?
Absolutely, absolutely. I think we're all looking for that optimal functioning state, you know.
We are. So now, I only imagine that when someone's actually performing or playing music, does this mean that the benefits of music are doubled if you're playing it as opposed to listening to it? Well, I mean, what would you say?
So that's a really interesting question. And I think that, you know, listening to music has a lot of similarities, but actually doing and playing, I think, reinforces it in a different way. And I think that's true for any of our kind of neural pathways in our brains. If we are doing an activity, if we are physically experiencing it, then that creates a different response, a different memory in our brain than if we're simply listening or visualizing. Doesn't mean that one is necessarily more effective than the other. It could be that you want one's effect more than the other, depending on the situation that you're trying to address. But I think it is probably a different experience. But I haven't researched that question specifically, so I do want to put that disclaimer on there.
Well, I thought of it as you were answering the other question, and that question brought about that question, and I said, "Oh, wow, that's interesting." But I like how you said it creates a different memory. I never thought about that before. It creates a different memory based on how it's affecting the brain, and the effect or the outcome that you're trying to stimulate. I think as a performer myself, when I'm performing, my brain is anything but calm. Because
Sure.
I'm worried about this note, this phrase, this time signature, you know, the the crescendo, the decrescendo. All these things are happening so fast. You're not a passive listener; you're an active partaker. But at the same time, it is very soothing to play for yourself in a mood or a situation that you're aiming for. So that's a nice difference balance to hold, the difference of the memory. I would like to look into that myself as a musician myself. Yeah.
Yes, I'll probably go back now too. It was a great thought, a great question, but definitely creates two different experiences from
Hmm.
what you're describing, you know?
Hmm. Hmm. Do you play an instrument?
I do. So I grew up playing piano and singing. And so when I went into the music therapy program at Ohio University, I chose voice as my principal instrument and then continued on piano from a music therapy perspective, which is a little bit more functional than the way I grew up doing piano performance. And then we also learn guitar and usually percussion as a part of our music therapy education. So we have to be proficient on all of those in order to be board certified.
Oh, wow. I never knew if it was required that a music therapist actually know how to play the instrument and how well they have to know how to play it, or if there's a level or degree that or threshold that they have to surpass. Wow, you just answered it. Well, yeah. See, none of these questions were in my mind, but when you start having a conversation with someone, it generates things, and it's like, wow. So let me ask you, why should a standard definition of health encompass the creative arts?
Sure. Well, I'm going to go back to my favorite World Health Organization definition of health. And, you know, that I love it so much because it really points us to the recognition of the whole person and also our environmental influences when we are deciding or determining, you know, what does healthy look like.
Mm-hmm.
So the creative arts, as we've been talking about, provide a pathway to express not only our individual humanity, but also to connect us with others in the world around us. And I think we can utilize this pathway intentionally to access a level of healing and a standard of care that really allows all of us to become fully healthy.
Mm, it was well said. Very well said. Well summed up. Well, I've appreciated this brief discussion on art and music therapy. I think you've definitely given our listeners something to look forward to and to continue their own personal research on, kind of what their appetite into an instrument that they may want to start playing, not per se even for performance purposes, but for health purposes, for therapy purposes, for soothing purposes. And as you said before, it helps with decision making, behavior, and other neural pathways. So the benefits are immense. Not all musical instruments have to be performed to the capacity of Carnegie Hall or a special stage or something for the benefits to be recognized. So I'm happy that that's the message also that came through our discussion today, Amy.
Exactly. No, I enjoy talking about it. So thank you so much for having me. I really appreciate it.
Well, thank you so much, and thanks for your time, and we will talk soon.
Sounds good.
Okay, bye-bye.